I love hiking, and I love hiking because I absolutely love being outdoors. I love to look at nature. It really makes me appreciate life in general. It's a great time for me just to release, relax, and not think about anything other than appreciating nature. I'm Sandra Tsai, and I'm trained as an internist, but I've done a fellowship in preventive cardiology, and I've been working at Stanford for 3 years in the preventive cardiology clinic and the women's heart health clinic. Because I take care of patients and I counsel patients on heart healthy things, it makes me actually want to be healthier, because I realize that oftentimes my patients will ask me, what do you do? And then I want to be honest, and I also want to understand how challenging it is for them to do the things that I ask them to do. I have seen a lot of women actually not think that heart disease or cardiovascular disease is a risk for them. And so for a lot of women, I try to really emphasize that their lifetime risk for heart disease is really high. And so many women are so busy taking care of their families, their children, their husband, they also work, and oftentimes they forget about themselves. And so I really stress to them that putting their health as a priority is so important, because they do want to ultimately take care of their families. So my favorite heart healthy food is salads. And the reason is that I find salads to be extremely diverse. So if I just want something like fruit and salad and some dressing, I can do that, or it can be very fancy. I love beets and chickpeas and tofu. Oftentimes when I'm choosing a food, my patients will actually come into my brain, and I will really try to make a healthier option, because I think to myself, I've told people to do this and I need to live this same way. My worst habit is I absolutely have a soft spot for salty foods. So I love nachos and chips, and so I really try not to buy them and put them in my house, because if I do, I will eat them. In general, all of the healthy behavior changes that oftentimes we talk about are so difficult to do, but at the same time, I see so many patients and I see lives change dramatically, because when patients actually put themselves as a priority, they make a huge amount of difference.